In summary, let me talk to two governments. Let me talk to the central government. I'm talking to His Excellency the President of Kenya, Dr. William Ruto. I'm talking to His Excellency the Governor of Mombasa, Dr. Ibrahim. This is the reason why I'm talking to them. 80% of healthcare in this country is obtained from private sector. If you want to treat private sector as a business, let it be clear and stated very clear as a private sector business. Decide who we are paying permits and licenses to. Are we paying to the national government through Kenya Medical Professional Dentists Council, or are we paying to the county through the single permit? We are not objecting to pay permits and licenses. That is not our problem. Our problem is make it easy for us doctors to serve the people. Number one. Number two, we are not objecting to taxation accountability. So none of us is saying we are unwilling to pay teams. What we are saying is be realistic. Realistic in the sense that not every person who works in this country has money to pay for medical services. Doctors are not even being paid more than 5 or 10 years by some insurance, even the government itself. All the facilities is so much amount of money. Yet you are coming and not even understanding that and demanding that the moment I offer a service, I pay the tax due for that when till comes, and you've not paid me. In essence, you are making me go borrow money from the bank to pay you. And then you complain medical services are expensive. I have to get money to make sure services run. So we are asking the two levels of government to sit together and agree. How do they make sure UHC is realistic? We want UHC. We believe Kenyans must be served fairly and equally with the best quality of care. But that is not coming through taxation. It's coming through collaboration and understanding and working together. Come together, put us on the table. KMA is waiting to sit on the table and negotiate that position. We get a consensus. Number three, we are saying this. County government of Mombasa, kindly stop harassing medical stores. Stop harassing hospitals. If you're a legitimate case, send a demand note. There's a legal way. If I've not paid a demand note, then we can actually get together and agree, is it legal or illegal? I understand it's illegal from my position as Vice Chairman of KMA Kenya. I understand it's illegal. But I am willing to listen to you. So that I can actually, I don't harass. Because when you harass that doctor, he doesn't serve that patient, you have an emergency, who loses? It's the same Kenyan that you're trying to say you're representing. I know we say doctors have so much money, and I understand that. What people miss is one thing. Doctors are a show business. Let me make it easy for you, members of the press. If I came to a hospital with a bicycle or walk on a foot with dirty feet and I walk to treat you, at the same time I came up with a Prada and parked on the door, who would you be happy to be treated by? I'm trying to make it simple for you guys. I make a show to build your confidence. Most of the Kasi doctors driving are all on loan. And they're on loan because they've not been paid. So when you wake up and say that doctors have money, want to charge you, you are simply creating a facade and making medical expensive, very expensive. Charge me 6,000, 600,000, I'm happy to pay, but be willing that you pay that. It's the only industry that serves people and is not allowed to charge free. If I increase my medical service fee by 50 shillings today, it will be in the media. Doctors have become expensive, they're treating Kenyans, they're taking money, and they will do that. We are saying this. We believe in UHC, Mr. President. We believe in UHC, Mr. Governor. We want to work together and make sure this thing is delivered. But it's only delivered by coming together and collaborating and making service delivery sensible at that particular level of cost. And affordable, that's to be. Finally, because we'll issue a statement. Finally, let me put this. It is unfair to have all manners of taxes levied to the same individual from different individuals. Let me simplify it this way. When you walk into a hospital, as a doctor, when I treat you and I want to do a lab test, do you become a separate business? If I want to get an X-ray to confirm you have a pneumonia, I become a separate business. If I want to ask you to go with the medication, it's a separate business. The end of my service is in you working out with the medication, isn't it? So all these things are towards me giving a service. When you separate them and start charging me levies for each or one of them, you're making it expensive for the patient. Sit down together, all you both, and agree on a single fee. Tell us what we pay you as a single fee, then it becomes easy for us to give you a price for service. I do not want the business of being made as a trade. I went to school, I was never taught to do business. In fact, doctors are the worst businessmen you can ever meet. We were never taught business, we were taught how to treat patients. If we start thinking business, my friend, we will charge you terribly. We will charge you terribly. I can give you an inkling. Right now, as I speak, the act that is providing us to charge is the Kenya Medical Professional Dentists Council Act. That provides for how much money we should charge. I invite you, the members of press, go download that, it's available on the internet, and visit also and find which doctor is charging that amount of money. 2016, sorry. We are not even charging a third of that amount of money. We're not charging that amount, but yet you're punishing us because we're being lenient. Why are we being targeted? Because we are so stupid, we understand Kenyans' rights. We are so stupid, we don't want to run for money, we care for your health. We are saying this. Please don't push us to the place where we change and become businessmen. Because when we become that way, it means unless you pay me first, you get what? Healthcare. SHA has provided for the levels of care, emergency and all those, and provided with a fee. Meaning, it understands that medical cost is expensive, it's providing for a limit figure pay. As much as we may struggle with that, let's understand this. Government has said, we know it's expensive, so we'll tell you what to charge. But you are coming on the other hand and telling me to pay you more than actually I'm able to run. You're basing your judgment on what I was paying 3 years back, but you're coming and charging me more than that. Hospitals will not succeed. So if it's not clear and it's not spoken clear, we will give you members will give you a statement, President. But let me put it this way. We are speaking with a single voice on this country. Council of Governors, central government, sit together and let's realize this thing called UHC. Let's make it public. Let's make it easy. Let's make it accessible. If you still push us to this end, then we will withdraw our services to make the settlement very clear. If within 2 weeks we don't have this action taken, we don't have stopping to run as doctors, trust me, we will ask medical practitioners. If the government doesn't want to stop it there, let's 80% of practitioners stop, then you can feel that. And we'll stop it for 2 to 3 days, just to make a statement. 2 weeks from what? From now. If we don't get an action and a response, simple, we don't want goons. Call us on the table, we talk about it. And I'm happy the governor has invited us tomorrow to go and sing this. And I'm hoping, because I know he'll get this before we meet him, that we are hoping for a solution. We're not looking for explanations. We are hoping for a solution. Thank you, members of press. Now you invite us questions.
Your name, please.
My name is Dr. Ibrahim Matende. I hold the office of Vice President, Kenya Medical Association, and immediate past President, Kenya Medical Cost Division. Thank you. I invite you to ask questions. We know time has run, so we can allow a few questions. Anybody with a question? I've answered the questions well? Thank you very much. We will share with you the statement.